Hi, I'm Megan. I'm a registered nurse at Maternal Family Health Services. One of the most important things to learn during pregnancy is how to recognize maternal warning signs, also called red flags. These are not normal symptoms, and they can signal a medical emergency. Some warning signs are obvious, like chest pain, heart palpitations, trouble breathing, or feeling like you might faint. Others may be more subtle, but just as serious, like a severe headache that won't go away, vision changes, or extreme swelling in your hands or face. These can be signs of high blood pressure or conditions like preeclampsia. Watch for swelling, redness, or pain in one leg, which could mean a blood clot, and always report severe abdominal pain, contractions, vaginal bleeding, or leaking fluid. If you have constant vomiting and can't keep down fluids, a fever, flu-like symptoms, or overwhelming fatigue, those also need attention. Later in pregnancy, pay close attention to your baby's movements. Any decrease or sudden change is urgent. Minutes can matter. Your mental health matters too. If you have thoughts of harming yourself or your baby, seek help immediately. And after any fall, accident, or injury, always go to the ER. When in doubt, call your provider. Speaking up could save your life and your baby's.
Hello, I'm Lori Waskovich, a registered dietitian for Maternal and Family Health Services, and today I'm going to talk to you a little bit about the diet for pregnant women. The diet for pregnant women should emphasize foods containing calcium. Most pregnant women should aim for about 1,000 milligrams per day. Calcium is essential during pregnancy to build baby's skeleton and teeth, support vital nerve and muscle functions, and to help to regulate mom's blood pressure. Great sources are milk, yogurt, and cheese. There are also some important non-dairy sources of calcium, such as calcium-fortified plant-based milks and juices, fortified tofu, almonds, and dark leafy greens like kale or bok choy. Women will also want to include a vitamin D source, like sunlight, fortified foods, or prenatal vitamins, because vitamin D helps absorb calcium. Pregnant women need more iron also, about 27 milligrams per day. If pregnant women don't get enough iron during pregnancy, that can raise the risk of a condition called iron deficiency anemia. Symptoms of iron deficiency anemia can include headache and extreme tiredness, and can increase the risk of premature birth and low birth weight babies. The best absorbed sources of iron are from heme iron in lean red meat, poultry, and fish low in mercury. Plant sources of iron include beans, lentils, chickpeas, iron-fortified cereals, and breads, spinach and tofu. Iron absorption can be improved by pairing plant iron with vitamin C. For example, beans with red bell peppers, or orange slices, or iron-fortified cereal with strawberries. Food safety in pregnancy is crucial. Women should avoid unpasteurized milk and soft cheeses like brie, camembert, and queso fresco, unless labeled pasteurized. They should also not eat raw, undercooked eggs, sushi with raw fish, or undercooked meats, and they should limit high mercury fish like shark, swordfish, and king mackerel, and choose lower mercury options like salmon, sardines, and canned light tuna. Pregnant women should also heat deli meats and hot dogs until steaming to reduce the risk of listeria. Lastly, in order to help the moms maximize their nutrition and help control weight gain, pregnant women should aim for half of their plate to be fruits and vegetables, and they should focus on fruits and vegetables when it comes to snacking. Some healthy snack ideas for pregnant women include Greek yogurt with berries, whole grain toast with nut butter and banana, hummus with carrots, cottage cheese and fruit, trail mix with nuts and dried fruit, or a smoothie with fortified milk, spinach, and frozen fruit. To help manage cravings and nausea, snacks can be prepared ahead of time. Eating small, frequent meals instead of 2 or 3 larger meals can also help.
I'm Nicole. I'm a licensed social worker at MFHS. Perinatal mental health refers to your emotional and mental well-being during pregnancy and throughout the first year after having a baby. During this time, some parents experience what are called perinatal mood and anxiety disorders, or PMADs. These conditions are actually the most common complication of childbirth and can affect anyone, regardless of age, background, or experience. PMADs include more than just postpartum depression. They can also show up as anxiety, panic attacks, OCD, PTSD, bipolar disorder, or even psychosis. Symptoms may include feeling sad, overwhelmed, or irritable, having trouble sleeping or concentrating, losing interest in things you used to enjoy, or feeling disconnected from your baby. It's important to know you are not alone. About 1 in 5 women and 1 in 10 men experience depression or anxiety during this time. The good news is that help is available. Support groups, therapy, and medication can all make a difference. If something doesn't feel right, speak up. Taking care of your mental health is an essential part of caring for your baby too.